Hello everyone. So today I'm going to tell you all about the care plan on deep second degree burn. Okay. So this burn was a 17% and it was superficial burn. Okay. So first you will have to mention the identification data, that is name, age, then religion, marital status, education, then in which hospital the patient is, then the ward number, bed number, then when was the patient admitted into the hospital, so that the date of admission, and what is the diagnosis. Okay, so you all have to mention the full diagnosis. Next is why was the patient admitted on in the hospital. Okay, so that symptoms you all have to write. Okay, so see here, my patient was admitted with chief complaints of burns on face, neck, chest and upper arms, which she suffered due to her sari catching fire. So you all have to mention the reason why the patient was burned. Okay, so that will also come. Next is present medical history. So here you all have to mention why was the patient admitted, what is the degree of burn that the patient is having, and now currently he is on what medications. So here the patient was on medications such as amicacin injection, then Ciplox, Tramadol, then vitamin C, so then tablet vitamin and tablet bplex. Okay, then comes the present surgical history. So here you all have to mention whether the patient is going will undergo any surgery or not. That comes the past medical history. Okay, then is past surgical history. Then comes the personal and nutritional history. So you all have to mention how the body build of the patient is, what diet he consumes, does he have any habit of smoking, alcoholism. Okay, how is his sleeping pattern, and bowel and bladder pattern, everything will come under this. Now if she is a female, like woman, then you will have to mention the gynecological history. Okay, in gynecological history you will have to mention the age when the menarche was started, then age of menopause if she has attained, and you all have to mention the obstetrical history. Okay, next come the family history. So you all also have to mention the name of the family members, relation, age, their occupation and how their health status is. Then comes the family genogram. Now in medical surgical nursing, it is very means it is important that you all mention the 3 generations. Okay, and I've also given the keys. You all can go through these keys. Okay, next is the psychological and cultural history, and then comes the vital signs. Now monitoring vital signs correctly is very important. So your in vital signs you'll have to mention the temperature, pulse, respiration, blood pressure, and also you'll have to write whether it is in remark, you'll have to write whether it is increased or decreased. Then comes the physical examination. So see, I have here means very nicely I've written, mentioned everything here. You all can go through this. So first come the general appearance, then the mental status examination, then head and face. Okay, then comes the face, then eyes. Now you all have to mention where the burn is. Okay, so everything will come. And ears, you all have to mention nose and sinuses, mouth and pharynx, neck, lungs. So you all can go through this. Okay, heart, then breast, then abdomen, extremities, lower extremities, back, genitals, integumentary. Okay, now in burns, when you all are doing physical examination, mentioning GCS score is also very important, so it will also come. Then comes the burn assessment. Now doing burn assessment is very important. Okay, so you'll have to write the depth of burn injury, whether it is superficial, deep, first degree, second degree, everything will come. And then you all have to write how much percent the burn is. So in my case there was 17% burn. Okay, now this the degree of burn, how much percent, you all will understand by doing the assessment. Okay, so there are various methods. So according to the hospital you all are posted in, like the hospital policy, you all have to see what method they use, and according to that you all have to do this local examination. Okay, so you see anterior and posterior head, how much degree burn is there, then neck, then trunk, then total you all have to calculate and write what it comes to. Okay, next the investigation. So this investigation you all will get on the case paper of the patient. So you're seeing I have mentioned the complete blood count, then the renal function test and liver function test. Okay, Next is the medication. So you all have to write the patient currently is on what medication. Okay, so you all have written, say, silver sulfadiazine. Okay, then ringolactate RL. Then I also have mentioned the dose, route, frequency. Okay, you all can go through this very nicely. I have elaborated and written. Okay, the same we all have to write. Then amikacin. Okay, then tramadol. See, everything I've mentioned. Okay, then comes the nursing process. So in this you all have to write what problems you identified in the patient. So according to that, on the priority basis, you all have to frame the nursing diagnosis. Okay, so you see, my patient was having acute pain, then impaired skin integrity, fluid volume deficit, anxiety, and risk for infection. According to that, the diagnoses were framed. Okay, so you all have to write 5 diagnoses. From that you can explain any 3. Okay, so see, I have written your acute pain. So you all have to, when you are doing the diagnosis of acute pain, no, you all have to draw this. The pain scale is drawing this pain scale is very important. Okay, so see, very nicely I have written everything. You all can just copy this. Okay, assessment, nursing diagnosis, expected outcome. What are the interventions? 5 intervention you all can mention. Implementation, rationale, and evaluation. Okay, so this care plan is for impaired skin integrity. Next comes the risk for infection. Okay, then is the health education. So you all have to write what health education you all will give to the patient or their family members. Okay, so I have mentioned your diet, exercise and rest, then the personal hygiene, then dressing, medications, and follow up. Okay, next come the nurse's note. So in nurse's note, you'll have to mention the patient's name, their age, the sex, then the ward name, ward number, and which diagnosis. You can also mention the unit. Okay, so see, now you all can mention 3 nurse's note. Okay, I've shown you all one. In the same way, you all have to write more 2. Then comes the progress note. So in progress note, you all have to write 3 days progress. Okay, minimum 3 days progress you all have to write. Okay, so 3 days you all have to mention. Then comes the last is the conclusion, and then is the bibliography. So I have mentioned here 3 bibliography. More reference also you all can add. Thank you.